We originally were actually going to have this presentation back in all the way in March in person prior to COVID, and we're really excited to hear from both Diane and Eric today to learn a little bit more about how to manage Parkinson's. And so, first off, a couple of housekeeping rules. I'll have all of the participants please stay on mute for the majority of the presentation. At the end of the presentation, we'll have about 10 minutes where both Eric and Diane will take questions. Throughout the actual presentation, if you have questions, feel free to use the chat feature, type in the questions you have, and I can interject at the appropriate time if it's relevant to what we're talking about. If it's more general, I can bring it up at the end, or you'll have a chance to unmute yourself at the end to ask questions as well in that last 10 minutes. And then after today's presentation, we're going to follow up with an email just like you got this morning that will include a flyer for our next event, which is how to manage Parkinson's. It will be in October, also Belmont Village with Broad Street partnering together. So stay tuned for that, in addition to the instructions for you to receive your CE credits. So keep an eye out for that email. And just quickly about, Belmont Village, we are a senior living community in the heart of Lincoln Park here in the city of Chicago. We are known for our assisted living and memory care and a program called Circle of Friends that's for folks that have mild cognitive impairment to moderate dementia. We haven't had any COVID cases with our residents over here, so we've been so thankful and just trying to stay safe and adapting to this new world. And I'm actually going to turn it over to Sam now with Broad Street, who will tell you a little bit about the great work that Broad Street does and introduce our presenters. Take it away, Sam.
Thank you, Lauren. Very much appreciate it. And thank you, Belmont Village, for the opportunity to present. We're thrilled to do this. I did want to, quick housekeeping thing. Nancy Siegel, who's our director of community relations, she will handle all of those CEs. So be prepared for her to follow up on that. So I'm Sam Cross. I'm the administrator at Broad Street Home Care. Broad Street provides senior support services to clients both in their home as well as in facilities. The reason I say senior support services versus the more traditional home care is that we provide a more solutions-based approach. It's much more highly engaged. It's much more collaborative with our clients' healthcare network. Our service is particularly effective for clients that have more complex underlying health conditions, specifically Parkinson's and other movement disorders. So we do this, our service is a little bit different. We have very deep engagement from a team of care supervisors that oversee all of our care. These are professionals that have backgrounds in nursing and physical therapy. And they're very directly involved, both in terms of providing client-specific and symptom-specific training to the direct care professionals who are providing the support. But they also are a bridge, really, to the healthcare network to ensure that any clinical or therapeutic direction is directly involved into the daily routine. So that's what Broad Street does, is a little bit more intense focus and more solutions-based. This Parkinson's presentation is part of a series, as Lauren alluded to. Today we're going to be talking about exercise. Eric and Diane are going to be going through the importance of that in a Parkinson's support. And then next month we'll be talking a little bit about how to directly provide daily support in the daily routine, where we'll have Lori Holland, who is actually a care professional with Street. So a little bit about the presenters. Eric Johnson is the founder and CEO of Movement Revolution. Movement Revolution develops neuro-intensive exercise routines and personal training, specifically focused on conditions such as Parkinson's. These routines are custom built and designed to empower people with neurological conditions to live stronger every day. We're thrilled to be working with Eric. I've known him for many years and really value what he does and what he does for clients. Diane is the clinical consultant at Broad Street. She's a master's of social work, educator, support group leader, program development specialist, and clinician who provides counsel for individuals and families. She was chosen to head up the Northwestern Medicine's Center for Excellence. She was instrumental in developing the collaboration between Northwestern Medicine's Neurology Department and Shirley Ryan Ability Lab. She provides a lot of value to Broad Street. In addition to community education and training, we're very pleased that she, can be a resource for both clinical consultation to Broad Street staff, but also direct counseling support to Broad Street clients. So with that, I'd like to introduce Eric and Diane. Thank you very much. Again, Lauren and Belmont Village, we love partnering with people that really care about what they're doing. And so we're thrilled to be here today. Thank you.
Okay. So are the slides up or?
Here we go.
Oh, here we go. Okay, very good. So first of all, again, I want to reiterate what Sam said. I want to thank Lauren and Belmont Village and also Broad Street for having me do this. And it's an honor to work with Eric. We started together in Parkinson's disease so many years ago in the early 2000s. And here we are still both working together. So it's just wonderful. So an overview of today's presentation. I was thinking about it this morning and how things have changed over the years. And of course, you can't learn about Parkinson's exercises without understanding Parkinson's symptoms. And that's what we're going to talk about today. But nowadays, hopefully, one doesn't receive a diagnosis of Parkinson's disease without also receiving the order to exercise. So they really go hand in hand. If you have Parkinson's, you should be told from the get-go by your physician, your neurologist, that you need to exercise. So our two parts here, Eric's and mine, really fit together hand in glove. So we're going to talk to you about the features of Parkinson's disease, and then as I describe a feature, Eric will demonstrate an exercise appropriate for that symptom of Parkinson's disease. And then he's going to back this up with the research that over especially the last 2 decades is really now demonstrating and confirming what we always thought, which is the benefits of exercise for Parkinson's disease. We'll talk a little bit about other benefits besides the physical benefits, the social and emotional benefits of exercise. And Eric will conclude with keeping an exercise program going so that our community of people with Parkinson's disease is not just exercising when they have an order for PT or when they're in class, but it becomes a part of their daily life. So Eric will conclude with that. So with that, we'll talk about the signs and symptoms of Parkinson's disease. You can go ahead. So there are 4 hallmark features of Parkinson's disease. By the way, I'm not sure the level of understanding or experience of the audience. So for some of you, this is going to be basic information. For others, it will be an explanation and we'll all be at the same baseline when we're talking about these symptoms. So when a doctor makes a diagnosis of Parkinson's disease, he or she is looking for 4 possible signs, and for one to have a diagnosis of Parkinson's disease, they need to demonstrate at least 2 of these 4, which are resting tremor, stiffness, slowness, and a postural instability and gait disturbances. So I'm going to describe each of these symptoms, and then you assume that someone with Parkinson's has at least 2 of these 4, and Eric will demonstrate exercises that target these symptoms. Okay, next. The resting tremor. Okay, this is the one that's associated most highly with Parkinson's disease, but everyone who has the diagnosis does not necessarily have the tremor. About 25% of people with Parkinson's don't. But if one does have the tremor is what we call a resting tremor. It's not a tremor upon picking something up and using it, and then the hand begins to shake. Rather, it's a tremor upon rest without use. So if the arm is hanging by one side and the fingers are moving or jittering, or the whole hand is tremoring when it's not in use, that's what we mean by a resting tremor. Parkinson's disease typically, if there is a tremor, starts in one hand or foot and on one side. Okay, next slide. This will be a demonstration of exercises targeted for tremor. Eric. No, you're on mute.
I hope people, sorry about that. I hope people can see my screen up in the upper right-hand corner here. And I think I can talk briefly about some of the exercises that are going to be beneficial for this particular symptom. And then I'll go and maybe make my screen bigger. I'm not quite sure the best way to do that, but I think I'll try to demonstrate as best I can. So there's been little research out there that's shown the benefits of particular exercises for tremor specifically, but anecdotally, there have been a lot of reports on various different forms of exercise that would be beneficial for tremor. So one of the things that we've experienced, and you kind of just get the concept of what a tremor is, it's an involuntary muscle contraction, and it's repeated over time. And if you think about how often that happens throughout the day, those muscles tend to get pretty tight and pretty rigid, which we'll talk about in a minute. But the biggest thing that I've seen to be the most beneficial for a lot of our clients are primarily a couple different modes of exercise. Anything to help kind of reduce the stress on the mind and the body. So those being meditation and Tai Chi, those have been shown to be very beneficial at managing stress and anxiety for people with Parkinson's and people without Parkinson's. But then along with that, we've actually had some clients that participate in our boxing program have a significant benefit from the resting tremor and a reduction in the resting tremor after going through a regular boxing exercise program. So that's actually, if you guys are familiar with the Rock Steady Boxing program, that's actually how Rock Steady Boxing got its name, was that the founder of Rock Steady had Parkinson's disease, resting tremor primarily being one of his dominant symptoms. He started boxing quite regularly, and he was at an event and he held out his hand and it wasn't shaking. He said, "Look, I'm rock steady." And that's how Rock Steady got its name. But we haven't had that same experience from everyone that's participated in the boxing classes, but I think there is something to high impact, forceful, exaggerated motions to help combat some of the symptoms of tremor. But I think most often when you're thinking about a resting tremor, the more we can do to help someone relax and come down from that, the better the results are going to be. So I don't know if you guys can see me, and if you can't, feel free to pop up in a chat. If you want me to make my screen bigger, I can maybe stop sharing my screen and demonstrate some of these things, and maybe bear with me. I think I'm going to try to do that. So let me
give it a shot. Yeah.
I'm out of here, and I'll maybe make me speaker view. There we go. So when looking at different stretching exercises for individuals with tremor, a lot of times we see that tremor happening the most in the hands and the forearms. Sometimes it progresses down through the legs. So one of the things that I give all of our clients to do is just a basic forearm stretching. So we call this the prayer stretch. So just pushing both hands together, pressing those palms together, big wide fingertips. If you want to work on it, making it a little more difficult, you can kind of have them spread their fingers out nice and wide, and simply just pushing those hands together, and they should feel a nice stretch on the bottom side of the forearm there, which is affected a lot of times with the tremor. Parkinson's tends to be more flexion oriented, so this really helps stretch out the muscles of the wrist, and then you can rotate them down and then all the way back in toward their body. So that's just a good daily stretch when we're talking about stretching to help reduce tremor. That's one of the best ones that I can think of to give all of our clients. And then also, you know, sometimes the tremor starts in one finger, or it's predominantly more in one finger that affects handwriting and things of that nature. So simple forearm stretch from here, or individualizing each finger, can help increase individual joint dexterity and mobility. But when we're thinking about Tai Chi and relaxation, we tend to want people to find a position that's very comfortable for them. If we're trying to reduce that seated resting tremor, you know, sitting in a comfortable chair and just relaxing your arms down at your side. And if any of you guys have gone through or heard of progressive muscle relaxation, it's kind of a form of meditation, but it's just essentially being aware of your body and space. And the one thing I really like to pay attention to are the fingertips. So a lot of times we tend to clench up our hands and hold a lot of stress here. So I'd like to have people open up their palms, sit back, close their eyes, and just take some deep breaths in through their nose and out through the mouth, and have them just really focus on relaxing all of the tension of their hands through their fingertips. So melt your fingertips down through the floor. So those are a couple different exercises for tremor I think that are really helpful. I'm going to be going through some different exercises that incorporate boxing in a little bit for some of the other symptoms, and we can kind of go through those as we go. So I'm going to kick it back to Diane here. I'll reshare my screen. Back to the presentation.
Okay, so the next symptom that we're going to talk about is rigidity. And this is something that affects most people with Parkinson's disease. Rigidity can also be seen as like a stiffness or a tightness, where muscles are unable to relax, unable to stretch. This affects gait, it affects posture, it affects getting up and down from a chair, and initiation of movement. It can affect swallow, it can affect facial muscles where there's a blank expression on the face because the muscles in the face are stiff and can't smile and grimace and emote in a conversation like we're having now. So it may be hard to read somebody's reaction while you're speaking. So rigidity is across the board in people with Parkinson's disease due to the disease itself, the dopamine deficiency. Okay, Eric, next slide will be some exercises for the rigidity of Parkinson's disease.
Yeah, and I see, you know, this kind of one being the cardinal signs and symptoms that a lot of our clients experience first. A lot of our young onset or newly diagnosed clients may have experienced rigidity or say, I've always been a tight person. My muscles have always been pretty tight. And I think that could be a slight progression of that disease. And it gets to a certain point where they notice it even more. But a lot of times people aren't even necessarily aware of a lot of the rigidity and the symptoms and how that impacts their movement. So it's one of the first things that we address with our exercise routine. And if you guys have heard of the LSVT big exercises, the power moves, which stands for Parkinson's Wellness Recovery, are some of the first forms of exercise that have really targeted, you know, and then are beneficial for people with rigidity, as well as bradykinesia, which we'll talk about in a little bit. But in order to move, I mean, one of my clients always says it's a movement disorder. You just have to move. And to combat the symptoms of rigidity in particular, you got to mobilize those joints. And some of the best ways to do that are to elicit those much bigger movements. So along with that, once you kind of make them more mobile through these big movements, incorporating cardiovascular exercise and a regular stretching routine are the most important things to make sure we can try to maintain and kind of monitor and keep that rigidity at bay as best we can. So I'll go through and I'll demonstrate a couple things here. So as Diane said, you know, it manifests itself in a lot of different motions, but a lot of times one of the things that we notice most is, you know, someone's arm starts to swing left, right? So they're walking and one arm is swinging just fine and the other one kind of hangs down at their side. What happens when that happens, when that arm swing stops working quite as well, is we don't get as much natural trunk rotation and axial rotation as people are walking, which causes a lot of trunk rigidity and instability, so it makes it difficult for people to roll in bed, get in and out of cars and things of that nature. So one of the things that we do to address that, and this can be done from a seated or a standing position, you know, all these exercises can be modified. I think no matter what someone's ability level is, whether they're confined to a wheelchair, a hospital bed, their bed at home, or they're running marathons, you know, there's a certain way to address all of these symptoms at any ability level. So we can answer questions on that at the end, I suppose, if you'd like. But one of the big things we like to start with is, and one of the power moves and one of the big moves involves a big twist. So that's a big rotational movement from one side of your body to the other. So a lot of times, because of that rigidity, people like to move quickly and short as they shift their weight from side to side. So emphasizing how big the movement is and exaggerated the mindset and the thought process is plays a big part in it. So we tell people to open up nice and big, and when they're here, stretch those fingertips out as big as you can. That way you get more trunk extension, and then we go into a nice big rotation as you go from one side. So I always like to cue the arms moving, or the eyes moving with the arms, or whatever joint is moving. That helps improve range of motion when someone is doing a particular exercise. So this can be done from a chair as well. If they're seated in a chair and you say, take that left arm and reach all the way back behind you and have your eyes follow that hand as you go from one side to the other side. If you think about what you have to do in this position that's tough for a lot of people with Parkinson's, is grabbing that seatbelt, pulling it across their body, or rotating in and out of the car to get out of that low chair or the car seat. So big trunk twist, okay? One of the big things that we really like to work on for rigidity. Other things incorporate, you know, being on the ground and doing a lot of what we call power moves and stretches from that position. But I can go elaborate with that in a little more detail if we have time at the end. So I'll kick it back to Diane here.
Okay. So the third cardinal feature of Parkinson's disease is slowness. So automatic movements don't come with fluidity. They don't come automatically. And as we mentioned with rigidity, and slowness is really like a part of rigidity, but also a symptom in and of itself, because everything is slowed down. Every movement is slowed down. Initiation of movement is slowed down. So somebody may freeze as they're starting to take a step. They may be unable to. And it's also sometimes referred to as an abnormal stillness, like the person will just appear still, unanimated, inactive, and still. Their mind is still working, but in appearance, they may look like they're not there. So the slowness is another major hallmark feature of Parkinson's. And next, Eric will demonstrate some exercises for slowness, or the technical word bradykinesia. Okay.
Yeah, so you know, bradykinesia certainly, like as Diane mentioned, comes right along with a lot of the rigidity, causing some of the bradykinesia as well. And much like the power moves that we work on for the symptoms of rigidity, we also work on for the symptoms of bradykinesia. So trunk rotation and mobility is one of the things that we really focus on for rigidity, but the bradykinesia certainly impacts the people's ability to take bigger steps. So things like boxing, the Parkinson's Wellness Recovery, big mindful movements with a lot of intention or mindfulness. I'm sure you've all heard that before, but and then high intensity interval training, which has been studied a little bit in research as well, which we'll talk about in a bit. But I'll stop sharing my screen here and kind of take you guys through some of the boxing principles that we work with. And what we do in our classes is we kind of integrate a lot of the big moves, the power moves, into some of the boxing classes that we offer. So if you think about what boxing is, you never see a boxer standing still in the ring just punching people here, right? It's a very dynamic sport, and it requires a lot of agility, a lot of multiplanar movement. So I think that's one of the reasons why it's very, very beneficial for individuals with Parkinson's to combat these symptoms that we're discussing today. Because if you think about it, and if any of you are familiar with the LSVT big exercises, they're all multiplanar movements, they're all high intensity. And if you kind of think about how you watch a boxer throw a punch, and a lot of those same principles are tied right into boxing. We found that it's a great avenue for our clients to kind of not just do the typical exercise of, you know, I got to take my big step forward and back. So what we do to kind of adjust that is cue them to take a giant step forward, okay, with a big tall posture, and then we work on throwing some punches, okay? So with boxing, there are 6 different punches that we work with here at our gym, and they involve jabs out to the front. And we've been doing a lot of virtual sessions, so we can't really hit a bag, so we kind of lose that benefit of the impact. But when we're thinking about kind of going back to tremor and rigidity and tightness in the hand, one of the things that we really focus on, it's a great thing to apply for people at home, is when you're punching out to really explode those fingertips out in front of you. So you're making a big fist as you pull back in, and then exploding those fingertips out as you punch out to the front. So big explosive punches here, and then you have hooks, which is a rotational punch. And obviously, as you can see, that requires a lot of trunk rotation, along with a lot of hip mobility, so and weight shifting from right side to left side. So when talking about a lot of the gait disturbances that kind of coexist with the slowness of movement and bradykinesia and the freezing, one of the best ways to combat that is through better weight shifting. And one of the ways we can naturally cue that a little bit better is by just getting someone to throw a punch. You know, a lot of the big moves are typically like a big rock from side to side. And that's one of our warm-up exercises that we'll do, and then wrap that right into a big punch as they go from right to left, okay? And the same thing, our last punches are uppercuts. Here, we really emphasize big, tall posture at the top. So talking about high-intensity interval training, that's been studied a lot on treadmills, recumbent cycles and spin bikes, but we incorporate that a lot into our rock steady classes as well. Is it's not just about the boxing, it's a lot about the footwork, and it's a lot about the intensity and kind of maximizing the intensity of the individuals in that class. And obviously that's a little bit different for everyone. So we have various different agility exercises that we can incorporate into the workout program. And people can do this at home with various objects around the house. And obviously, if someone is not able safely to step over objects, then that's something that you really need to work on. You don't need to use anything on the floor at all. So I've kind of progressed these different the pieces of equipment on the floor here, starting with the hurdles as the most difficult, then down to the cones, which is a lower level, and then onto the floor here, which is just an agility ladder that's kind of one with the floor. So it's nice and flat. But obviously, the higher the obstacle, the higher the amplitude the movement needs to be. And that exaggerated movement really helps elicit a bigger movement. And a lot of times that physical cue and that visual cue helps elicit a better movement for the individual with Parkinson's. You can tell them to step big, but they don't necessarily internalize and know exactly what that means. So if you can give them a target to hit, that's one thing that's very beneficial. So we work on taking these over with, lateral stepping, forward stepping. So we're still emphasizing the weight shifting and those big dynamic movements. So we'll kind of kick it back to Diane here for the next one.
Okay, great. Perfect. So the fourth hallmark feature of Parkinson's disease is a stooped posture. I'm sure that most people have observed this, have seen this. The stooped posture is really the feature that puts people with Parkinson's disease at the greatest risk, because if their posture is stooped, they're bent over, they're looking down, and their feet may even be frozen to the ground, that is where the the great risk of falls is. So the stooped posture is something that always has to be addressed. And the stoop posture, as a result, can cause that freezing of gait that I've described, but also a festinating gait, which is taking many, many little bitty steps to try to get going. The stoop posture also affects all the other natural movements that one has to make during the day, getting in and out of bed, getting up and down from a chair, turning, pivoting. So these are the, this is the feature that Eric will demonstrate some exercises now.
Yeah, and you know, okay, we're good. So posture is one of the first things that we address, kind of after flexibility and mobility to combat some of the rigidity. Posture and postural awareness is something that we tackle next. And that involves a lot of core stability, a lot of mind-body awareness. So if you kind of think about what types of exercises are good to kind of help people, make people more aware of their body, you know, postural exercises are great. Tai Chi and yoga are also really, really good at making people more aware of where their body is in space, which can really help draw more awareness to posture and postural instability. And one of the things that we try to do is kind of going back to that mindfulness principle is really trying to enhance the person with Parkinson's ability to recognize where their postural deficits are. And a lot of times they're really not aware of them. So, you know, we have an assessment screening tool that we use. It's called the Posture Screening Mobile. And that just kind of helps us get a picture and help show the client exactly how their posture affects their standing posture and positioning. And then we kind of relate that into all the things that Diane discussed with some gait disturbances, fall risk and things of that nature. So I think one of the biggest things that we talk about is if you think about how heavy the average human head is, somewhere between 12 to 18 pounds. And if you think about a 12 to 18 pound bowling ball sitting on your hand here and how easy is that to hold up, and what happens if you tip a little bit forward, it throws you way off. And if we talk about, you know, some of the things that are commonly associated with Parkinson's and rigidity and postural instability, it commonly comes along with low back pain and muscle aches and tightness. So it all kind of stems into a lot of these different difficulties with other orthopedic-like conditions. So a lot of the things that we do to really focus on that postural instability are some of the agility exercises that I had just shown on the ladders or the agility hurdles. But a lot of the things that we do to address postural instability don't even necessarily have to do with like the chest and the shoulder muscles themselves. So let me demonstrate a couple of these things. Boxing is a great way. We don't have a speed bag in the gym here today, but if you've seen the speed bag that's kind of mounted up top and the boxers always are hitting it like this, that's one of the exercises that we can incorporate into the boxing exercises that really emphasizes that chest expansion, you know, that back extension, and then keeping those hands and those shoulders up keeps the gaze upward. So a lot of times that gaze is always looking down at the floor because they're fearful of falling, and that's where practicing those over-exaggerated steps over targets like this will help them improve their confidence with those things, because I think a lot of times some of that postural instability is built in with a little bit of fear of tripping over something or falling, especially if they've had a fall, they're going to be more fearful of the fall moving forward. So just with repeated practice, those things really, really help. But to talk about kind of the mindful awareness of where your posture and positioning is, and this is kind of comes back to a lot of the power moves. I'm going to get down to the mat and show you guys a couple things from here. So I like to kind of break it down if people have the ability to get onto a mat table or down to the floor. This is a great place to make people more aware of where their posture is and how it affects their trunk stability, because you don't have your feet to compensate. So one of the things we do is kind of get them down into quadruped position here and just assess their ability to kind of get up into this tall kneeling position. So a couple things that I look at here is the positioning of their hips, their shoulders, and their head. And a lot of times we'll see this, right? And if even I try to do this, I feel an immense amount of tension on my hamstrings. It's hard for me to keep my balance, puts some strain on my lower back. And we can cue that right away, much easier from this position. So we'll cue that power up position, and we'll just work on a power up from here to here. And it's essentially a hip bridge from this position to bridge your hips up into this position. And so one of the ways that we'll progress this exercise is, it's great that once they accomplish it from here, but we have to establish a safe environment for them to work on a lot of these posture exercises, and sitting in a chair isn't all that practical because it's commonly affecting them more when they're standing and walking around. So we build it from here, teach them how to use their hips, teach them how to get their head over their shoulders. We'll put them in front of a mirror or videotape them doing it and show them. And then we'll progress it to a standing position and apply those same principles from a standing position. So, when we were on the ground, your hips were flexed and you were pulling your hips and your posture up. We want to do the same thing here. So the big way is to kind of carry through that work with the postural instability is to, one, make them aware of it, over exaggerate how big those movements are, and then progressively make it more challenging, more functional into the ways that it impacts them and, causes more instability for them on a day-to-day basis. And I think that's one of the most important things, is being able to relate the exercise that you do with them and how it affects, some of the difficulties that they have each day. So we'll go to the next one.
So this will be a brief overview of some of the research.
Did I skip a slide here, Diane?
No, you're on.
Yep. We're good? Okay.
Yeah, you're going to go on now and do some research, and then we'll talk about the rest of the Parkinson's disease symptoms. Yeah, and if anybody wants these slides, please email me, because some of them we may be going quickly through, and I'll be happy to send them. Okay, we're on 13.
We're on 13? Okay, sorry.
There you go.
I think one of the biggest things that I think I'd like to share is that every person with Parkinson's is different, and every person's exercise program needs to reflect that. And that's been shown to be effective, like in all the exercise programs that have been established. Most of them have shown to be pretty effective if they're done properly. So I just want to kind of review some of the research and what supports a lot of the exercise programs that are out there, and we can kind of go through that a little bit. But there's been a lot of discussion and awareness on the Rock City boxing program and boxing for Parkinson's in general. There are more and more studies coming out about what is it about boxing specifically that might be beneficial to people with Parkinson's. Anecdotally, we know all the methods and modalities within the classes that, in most classes that are run, why it's beneficial, but there hasn't been a ton of research that's looked at the benefits, like the long-term benefits of boxing on a large-scale study. So I know actually Dr. Baga at Northwestern, and they did some research actually with our group here in Chicago, as well as a lot of the groups nationally, on just kind of the quality of life for people with Parkinson's, and kind of what their perceived benefit from these boxing programs have been. And it was a tremendous result. I think they had over 1,000 people that had participated in this study, and had shown that 99% of the people that had participated in a boxing class would recommend it to someone else. And I want to say 95% of the people had shown a positive experience and received a positive impact from participating in that program. So even just from a psychosocial idea behind what are the benefits of boxing, I think we always have a message of a very empowering sense of self in the class. And I think that goes a long way, along with a lot of the dynamics that are incorporated within the practice and the exercise of boxing in and of itself. It's high intensity exercise. And, that's been shown to be proven to be beneficial in a lot of older studies. So this one, it's not about the bike, it's about the pedaling. And this study was all done with forced exercise. So it was done on tandem bikes. So we had, it was originally started at the Cleveland Clinic, and it started with kind of a driver in the front. who would keep a consistent cadence for the person with Parkinson's pedaling behind them. And I want to say it was 90 revolutions per minute or above for 30 minutes or more, I think at least 3 days a week. And it has shown benefits in gait speed, balance, mobility, and overall sense of self. So kind of that stems back, I forget what year that study was published, but it's gone back quite a bit of time now. But we can kind of apply those principles from a forced exercise study, and it's been actually improved upon in future studies, which I'll talk about here. But one study going into phase 3 clinical trials right now, this was the phase 2 clinical trial, the high intensity exercise delays Parkinson's progression. So it's known as the SPARKS study, SPARX, and it's done at multiple sites across the country. Both of the studies on this slide here were done in, the PI was Dr. Daniel Korkos, who is a well-published professional at, used to be at, in Rush at UIC, and now he's along with Northwestern. Published 2 great articles, fantastic articles on the benefits of exercise. The SPARK study looks at newly diagnosed early stage people with Parkinson's, not on medication, and exercising intensely on a treadmill, achieving above 85% of their maximal heart rate for 30 minutes, 3 days a week. And that has shown actually a lowering of their UPDRS scores. So actually reversing the disease progression effectively. So that was one of the first studies that looked at that, had shown that significant of results, which I think has kind of sparked, no pun intended there, sparked a lot of different studies looking at intensity based modalities for exercise. Now, the other one looked at a progressive resistance training. So we kind of look at these different studies. These are very traditional forms of exercise, cardiovascular exercise and strength. Both have shown to be very beneficial in other populations. And I think the same thing carries over here. What it does to the brain is kind of interesting when looking at Parkinson's disease, but specifically the progressive resistance training looked at, again, a multi-site study, looked at a 6-month strength training protocol where individuals were going through a various periodized program, which means you change up the sets, the repetitions of these various exercises over the course of 6 months to really, in a program that's been built to improve strength. I mean, you look at any, professional weightlifting operation, and they follow a very similar regimen, but this was done on machines you'd find at a typical gym. And they found that there are significant benefits to balance, mobility, and gait, even a year after the study had ended, a year after the interventions had actually been completed. So really, really interesting study there. So interestingly, this adaptive training with full body movements, this is done in 2015, and it'll be interesting to see kind of what comes out, especially since COVID and everything's been a little bit more virtual. And as technology advances, this study looked at using the Microsoft Kinect, which is a body motion sensing video gaming platform to assess one's body movements, just natural movements in space. And it showed to reduce some of that bradykinesia. So there was a very, this was a small pilot study, I believe, of only 7 people. But they did show that over the course of the study, which I think was about 12 weeks, I think, it improved the symptoms of bradykinesia. So it'll be interesting to see how technology can help improve a lot of these things going forward. But Tai Chi has been widely studied to help individuals with Parkinson's disease, specifically involving balance, and motor control, and again, that mind-body awareness. It's been, a huge study in the New England Journal of Medicine that's shown the benefits of exercise for fall prevention and balance improvement, particularly in Parkinson's disease. So if you can kind of get a sense of kind of all of these studies, you can see like some are very mind-body focused, some are very strength focused, some are very cardiovascular based. And I think it all depends on the person and what their symptoms are to utilize that research and really show kind of what's going to be the most beneficial program for them. So I'll turn it back to you there, Diane.
Okay. All right. So we don't have a lot of time left, but I'm going to emphasize the point of the next few slides, which is Parkinson's disease is defined as a movement disorder based on those 4 hallmark features that we started out with and demonstrated the exercises for. But there are many, many non-motor symptoms of Parkinson's disease. This may be worthy of a CEU on its own. Too much information to go into now, but just know that Parkinson's disease affects many other systems than the large movements that we discussed. So autonomic disturbances are a major part of Parkinson's disease with, I'm going to just define the orthostatic hypotension, which is upon getting up from a chair, the drop in blood pressure. All of these can also be clearly related to exercise because an exercise teacher or a care partner has to be aware of some of these autonomic disturbances while implementing an exercise program. You can go on. And by the way, I'm receiving some chats and I will be sending out slides. Multiple sleep disorders are part and parcel of Parkinson's disease. Everyone with Parkinson's disease will tell you that they have some kind of sleep issue. There are many different kinds, so just because somebody is telling you they're having trouble sleeping does not mean the same thing in every case. There are many different types of sleep disorders. I've listed them here and we won't go into a discussion of those now. Just be aware that sleep is a big issue in Parkinson's disease. Next. Okay, there are also sensory problems, and I think Eric alluded to these in terms of some pain. There can be numbness or tingling. There can also be some visual problems. Not only do these non-motor symptoms obviously impact the well-being, the emotional well-being of the person with Parkinson's and the entire family system, but if you're finding an exercise teacher, you need somebody who understands that these are part and parcel of Parkinson's disease as well. So don't assume that if somebody has Parkinson's disease, they don't have some other secondary symptoms. Okay, next ones. Swallow issues. Well, we talked about the slowness, and slowness definitely can affect swallowing, and the swallow issues can affect one's entire quality of life, socially as well as psychologically. And similarly with the speech issues. The speech can be slowed down, it can be mumbled, it can be hoarse, difficult to understand. You can see where it could make someone want to withdraw and not interact. Okay, next, watching the clock here. Okay. Cognitive and language difficulties. This is a big area, I think, of myth and misinformation. Parkinson's disease and Alzheimer's disease are 2 distinctive diagnoses and 2 distinctive diseases. Often when somebody gets the diagnosis of Parkinson's disease, they're terrified that this is an indication that they do or will have Alzheimer's disease as well. This is not true. Again, a topic of its own to talk about the different kinds of thinking and mental difficulties between Parkinson's disease and Alzheimer's disease. But in Parkinson's disease, the thinking, like everything else in the disease, is slowed down. It doesn't mean the person cannot think, cannot comprehend, cannot take in new information. It just means that it may take a bit longer. And they may also have the impaired visual spatial skills, another symptom that's important for an exercise teacher to be aware of. Mood disturbances, also part of Parkinson's disease. Depression and anxiety are very, very, very prevalent in Parkinson's disease, also very treatable. Apathy is another distinct characteristic of Parkinson's disease. Apathy is not the same as depression. It's been shown to be more an inertia, a lack of motivation, something that needs to be addressed in different ways, like exercise, structure, socialization, and things like that. Self-consciousness and social isolation, I think, are self-explanatory in that there are so many visible signs of Parkinson's disease that a person may develop a real self-consciousness, if not outright phobia or panic about being out in public. Psychosis and hallucinations, often due to medication, all of these things in mood and social behavioral disturbances, as well as all the autonomic ones, all of these need to be brought up to the neurologist, because there are interventions to target each and every one of these symptoms. Somebody just doesn't have to tolerate them. Okay. So I think it's a natural to go from the mood and social implications of Parkinson's disease to the social and emotional benefits of exercise. I think besides the clear, obvious impact of physical well-being, there is a huge emotional and social advantage to people with Parkinson's disease who exercise. And I just want to comment about the boxing for a minute. As much as the people with Parkinson's go to boxing and love it, I know just as many caregivers who take their person with Parkinson's to a boxing class, and the caregivers become their own social support and support group. So a lot of the benefits of exercise have a clear carryover to the care partner as well. And with that, I can turn it back to Eric for kind of transitioning exercise into one's life and into one's routine outside of classes. So Eric.
Yeah, so I'm sorry, I had to change rooms because there's going to be a class going on right next door. So I'm sorry if there's a little bit of an echo here, but you know, we've seen the tremendous impact that the exercise programs and classes have been for our clients. But as I mentioned before, you know, everyone's a little bit different. And one of the things that we really focus on, and everyone really needs to focus on, is how do you formulate the best exercise regimen and routine to help reflect your everyday life, as well as the symptoms that impact your everyday life. So, you know, what type of things do you like to do socially? What, you know, what type of sports do you want to continue to play? And that carryover from what do you like to do? What do you need to work on? And how is what you are going to do with us with your exercise program or wherever you exercise going to help what you like to do, if that makes sense. So we need to have that transition and direct translation into how it's going to help and impact them on a day-to-day basis. And everyone is so different. I think I can't value enough the importance of for every person to really know what they need to work on and how that can help improve their daily quality of life. As Diane said, you know, these exercise programs formulate this natural support group that is right, both for care partners as well as the people in the class. You know, we don't sit and discuss, you know, symptoms a whole lot in class. We practice a little bit of tough love, especially in the boxing classes. We acknowledge what their symptoms and their needs are, but, you know, people talk about those things on their own terms. If they see someone else going through something that they're going through, they ask if they have, and it just forms that natural support system. So it's really, really awesome. And then just to kind of talk about that transition into exercise, that's one of the things that we really try to specialize in, is continuing the patient turned client into the journey of community-based wellness and ongoing exercise programs. So, you know, sometimes if there's been an initial accident, fall, what have you, there might be an inpatient rehab. This is just kind of the typical cycle that someone with an injury or someone with a diagnosis typically might go through. And I think that the important piece at the end here is the community side of things, finding a way to stay engaged with an exercise program, get in a program where the professionals you work with know about your condition, know about your symptoms, and know how to help you manage them better. And then to not only create that community within the program itself, but then to create that community as your healthcare team to make sure that everyone's working together to help the participant or the patient in particular individually. So again, it's just that transition from maybe a physical therapy setting, or maybe it's transitioning from a regular exercise program where they don't feel as comfortable going into the gym, and maybe just it's tweaking and modifying it to whatever their needs are. And that's that transition of long-term exercise. So, so type of community-based programs, there are a lot of them out there now. We particularly specialize, again, in kind of individualized training at Movement Revolution. You know, that's kind of our specialty, where we really customize everyone's wellness program to whatever their needs are, whether that's, you know, that involves psychosocial support and health. It involves fitness and physical activity and exercise, as well as diet and nutrition. So we're kind of melding all those things together. But that very specific training program and multifacets of everyday life is really important. But there are a lot of other group classes out there and available. So we offer those here, both now in COVID times virtually, as well as we just started in-person classes with the Rock City Boxing with plenty of social distancing. But you know, anything that they can do to get out, get moving, have some support surrounding them. There are some great resources on the APDA's website, the Parkinson's Foundation's website for communities outside the Chicagoland area. You know, there are plenty of resources here in Chicago. We are based here in Chicago, Deerfield, western suburbs, and south suburbs. So if anybody needs anything, we're more than happy to help, but there are a lot of resources out there, and those websites are fantastic. If anybody has questions on those, feel free to reach out to me after today's presentation. I'd be happy to help. But thank you thank you to for everyone for having me here. Thank you, Diane, for co-presenting with me. And you know, we believe strongly that we learn from clinicians such as yourself. We are all exercise professionals. We don't do any medical billing. It is all community-based exercise. So we thank you for supporting your patients to get active and get moving. I think we can all learn from one another. So Diane, I'll kind of kick it back to you.
Just want to say ditto to everything you said. We wouldn't be here today if it weren't for the patients who have taught us along the way, and that's really where I learned the most, and next from my own mentors and the people at Northwestern. So thank you all for being here. I'm happy to take any questions you have by email, and thank you again.
Yes, thank you all so much for attending today. I have not received any chats with questions at this time. So I open it up if anyone would like to take themselves off of mute to ask any questions you might have at this time. And also I do have just a few people I individually chatted on a private message. If your name isn't on your device, I've got someone that's an iPhone, someone, just please check your chat, because I need to mark you down for attendance. And if I don't know who you are, you can't get CEU credits. So please check your chat features. But anyone have any questions for Diane or Eric?
I have a question for Eric. This is Eileen McFarland.
Hi.
Hi, Eric. Nice to meet you.
Nice to meet you too.
A lot of our patients have, that we work with at Cure PSP have, of course, MSA, PSP, and CBD. Some of these in the early stages of these movement disorder diseases mirror the PD types of symptoms. So my question to you is, as these people with these rare brain diseases progress, they are confined to, let's say, a wheelchair. Can you tell me, do exercises, like how would you accommodate that with the boxing routine? Because the boxing routine is a big deal, and a lot of our PSP And CBD patients, early onset of the symptoms, do the boxing. We have a great relationship here in Dallas with the boxing group, so, and the PD group.
Yeah. Yeah, no, it's a great question. And as I mentioned, I think every one of these forms of exercise can be adapted. It should be adapted for people in a seated position. I love working with atypical Parkinsonisms and finding ways for them to be more active. And I think, you know, if you think about a lot of the symptoms that commonly accompany a lot of those conditions is, you know, a lack of ability for proper gaze and hand-eye coordination, postural instability and seated. You know, what I find a lot is if someone's been in a wheelchair for a prolonged period of time, and they tend to favor one side, they might start with a trunk instability and a postural instability exercise. So a lot of things we want to integrate, especially the boxing, I mean, to really overemphasize if they commonly stoop and kind of sit back into their right, we want to focus on using that right hand to elicit a better punch over to that left side. So really working on a lot of those exercises from a seated position is going to be very beneficial, as well as a lot of the power moves. I mean, a lot of those are built from a seated position, and there are various forms and progressions through that workout that can take you from a lying position to you know, on your back, on your stomach, seated, kneeling, and standing. So it can all be adapted to those different positions. But I certainly think that there are lots of ways you can do that. If you have any specific questions or want to chat, I'd be happy to address that a little bit more offline.
I have a question. Can you hear me?
Yeah.
Can anybody hear me?
Yeah.
Yes, we can hear you.
I'm Bob, and my question is basically a little bit off topic, but the mental and emotional status of people who have PD and other support systems that can help support those people as they go through Parkinson's from beginning to end. What kind of help is there for those people in terms of mental and emotional support?
Very good. Okay. Part of this we can talk about separately if you want to email me, but in general, I will say that you want to make sure you have a movement disorders neurologist, not just a generic general neurologist, that the movement disorders neurologist has a team, meaning if not on site, immediate access to a team of physical therapists, occupational therapists, speech therapists, social workers, potentially nutritionists, psychiatrists, whatever the other disciplines are that may play a part in the treatment and in the care plan. Support group and or one-on-one support. And these resources can be found either through a Parkinson's Foundation Center of Excellence. If you're here in Chicago, that would be Northwestern Medicine or Rush. The Parkinson's Foundation itself, which has a Chicago office, Parkinson's Foundation, the Chicago, Illinois office, and the Parkinson's Foundation helpline, which is a 1-800 number. Happy to look that up for you. There are numerous support groups. I mean, unfortunately or fortunately, Chicago, if you have Parkinson's, Chicago is a good place to be. There are a multitude of resources. So that should get you started, and I'm really happy to send more along on a private basis.
Thank you.
Okay, sure. Are there any other questions?
Hi, yes, I have a question. Good afternoon. And first off, I want to say thank you. The presentation was excellent and really appreciate you all's time. I am a occupational therapist, and so We know that the carryover with family training and, you know, caregiver training is key. This question is really directed to you, Eric, in reference to the exercises that you went over. Do you by chance have handouts or something available that we can kind of, you know, as clinicians be able to refer back to be able to also do other education with our, you know, our patients, family members, as well as continue, you know, to develop our own library?
Sure, sure. Yeah, if you guys wanted to email me, I'd be happy to send out some of the handouts that we have for our clients and their family members. As well as I invite you to look at our website as well. Since COVID, we've kind of been trying to put out some resources online for different exercise programs, just things that people with Parkinson's disease can do on a daily basis. And we've tried to have a mix of different things that should be helpful from a strength perspective, from mobility, flexibility, and that's on our website, www.movement-revolution.com. And it's under our virtual tab. There are a few videos on there that you can follow along with. But you know, that's kind of a wide array of various ability levels. So if you wanted a handout specifically, feel free to email me and I can pass that along.
Great, great. Thank you so kindly.
Mm-hmm.
Okay, I think that's it, everyone. Thank you so much for attending today. I'll send a recording of this along with the slides to all of the attendees today. Please make sure that you keep an eye out for an email from Nancy, who will assist with getting the CE credits. And any other questions, you can of course direct to our terrific presenters, and they will be CC'd on the follow-up email that I send later today. So please, you know, join us for our next event too. We're going to be having one, I believe it's October 7th or 8th. Off the top of my head, I don't know, but I promise it will be in the email as well. We're going to have another wonderful conversation about how to manage Parkinson's so it doesn't manage you. So stay tuned, and thank you for joining us all today.
Thank you for presenting a great program.
Of course, no problem.
Thank you.
Thank you, guys.
Great job.